says daily, Dr. Vuu is back, and he's given answers to some of the most embarrassing medical questions that we're too afraid to ask.
Dr. Vuu, this is a thing, right? I feel like a lot of times people just go to Google now. Is that dangerous to do?
Well, I always encourage patients to be educated. But you have to be guided, because sometimes you go to Google and you'll diagnose yourself with something that's not very good.
Guilty.
That leads to more anxiety, more stress. Work with your doctor. Look things up, but make sure it's coming from a good, credible source.
I've always felt comfortable with the doctor, and as long as I'm there with the doctor, I've never been like scared to ask anything. But apparently some people are very uncomfortable when it comes to that, right?
Definitely. Now, so I always say this. I try to leave my patients letting them know that they're in a safe space and that everything I share is going to be completely confidential.
Right.
And then working over 13 years as a medical doctor, initially doing minimally invasive surgery and now doing performance and lifestyle medicine. In fact, Deepak actually helped me make that transition.
Really?
Yes,
Oh,
yes, yes. So really cool that I got to meet him
You
today.
just got the picture right there, which is great. What can we do better as patients? Like, what should we be asking?
Right. So as patients, I really like to know that they're proactive with their care. So questions like, when should I get my next screening? When should I see you again? Should I go ahead with the surgery or not, doc? And then also, as a performance and lifestyle person, I also want to know what their diet is. Are they sleeping well? If they're able to answer the most important questions like sexual questions, those are very hard to ask. Mental health questions are hard to ask. I like to hear about those.
Well, we've actually found a list of some of the
We've got
most
some sexual ones.
some embarrassing questions that doctors get that are not personal. Let's just say that. but here it goes. Peeing in the middle of the night. Actually, all of a sudden, it is personal because this applies to me. I can't make it through a whole night without having to go to the restroom at least one time now. Is that just age? And I thought it was my fluid intake, so I go to bed like parched, and I still got to get up at one point to go to the restroom. What's the matter with me?
So it happens a little bit more with age, both in men and women. For men in particular, as you age, your prostate tends to get a little bit bigger. So that might be something. Wait
a minute,
it's
hold
a very simple test to do.
I was just gonna say,
a simple test.
Wait, that test, medicine has come a long way. We still got to do that thing?
Just to make sure, just to see how long.
We don't have something else, doc? We still got that thing?
Or you could do an ultrasound, but it's an ultrasound up in that area too. So would you rather have the ultrasound or this?
Wait, what's the age for that? What's the age that I need to do that?
Well, when you're getting 40 and above, and particularly when you have those symptoms,
Oh, God.
Yeah.
By the way, I feel like we're the movie City Slickers. That one thing we used to.
Wait, this is like all of a sudden. I was having a good day.
My finger's not that long, Mario.
No. What about for women? Menopause is approaching. Is that going to decrease my sex drive?
Yes.
Whoa.
So, well,
I just took a turn.
So,
don't beat around the bush.
Right. Well, for men, beginning at the age in their late 30s, women around the menopause age, they start decreasing their hormones. So that's going to change the way you think, your sex drive, your performance, all those things. So in addition to checking hormones, very important to check your nutrients, check to see if any heavy metals and things like that. And super important, I advocate for my longevity patients, bioidentical hormone replacement.
Yes.
Okay, so there's replacement. Okay, what about this one? What happens when someone notices blood in their stool? This happened to a friend of mine, Tootie, and I was curious if it was
Not
something.
to mention age.
If it was, yeah, not to mention age. But is that something to be concerned with?
Right. Well, so I had a very funny story. A friend of mine thought he was, pooping blood, but he just had a lot of red vines. So really important to know.
Red vines, not Twizzlers.
That's what it is.
Right. Beets.
That's his first problem.
Beets and licorice, all right? If you eat that, it could turn out red.
Beets for sure. That happens.
And then there are more serious
One time
things.
I thought I was dying, but I was just eating a lot of beets.
Yeah.
Beets actually increases blood flow, so really, really good for the guys.
So it's all good for you then. It's good for you then.
Well,
if I eat a lot of beets, do I need this?
You still need this.
I still need
if
this.
You're still
I eat a
going
lot
to the
of beets.
bathroom.
What about me? If I eat a lot of beets, is all good with the hot flashes?
Beets is the new power
Well,
drug.
beets, Dr. Vuu.
All right, Dr. Vuu.
Yeah.
We're going to have to
Thank
come
you.
back. Big thanks to Dr. Vuu. We'll be right back after these messages from your local station.
A lot of good questions.
Wow. I don't want this.
City
I don't want